Everyone. This is Nishant Malhotra from the Medical. Today I'll be talking with Dr. Robert Karanja. Hello, Dr. Karanja. Great to have you here for a deep conversation on the evolving innovation within the social and development sector in Africa, especially in the healthcare sector and genomics. A very brief introduction. Robert is the co-founder of Villgro Africa. He has got a Ph.D. and Masters in Medical Parasitology and Entomology from Jomo Kenyatta University of Agriculture and Technology. He did his PhD and Masters from there, and he did his Bachelors in Biology from North Park University. Before setting up Villgro Africa, Dr. Robert wore many hats as a professional within the development sector in Africa. So, hello, Robert. Great to have you here.
Thank you. It's a pleasure to be here, and I'm excited to talk about the work that we've been doing in Kenya. So thank you
So,
for having me.
Sure. Robert, you wore many hats before setting up Villgro Africa as a co-founder. Now, please share your experience in enabling social change and impact within the development and social sector in Africa. So, this is more of a journalistic question. You could talk about your critical insights on the struggles and key successes in the early part of your work in building up entrepreneurship-driven system in Kenya or in Africa.
I was saying, I have a biomedical science background, and started off my career as a research scientist at the Kenya Medical Research Institute. And one of the things that I can say in terms of my my roadmap towards setting up Villgro was that, first of all, if you look at the setup for Cambridge, or for the research space within Africa, it's really interesting because we're doing a lot of investment. And so my big question was, what can be done? Why do we have so much poverty in our country? And yes, science can be able to solve some of the problems that we're facing, but how do you then translate that science output into impact? And beyond the clinical studies and the validation, the translational research, how do you actually solve the problem for the community that you live in? Sharing about a little bit about my journey and being able to participate in this international training program on innovation systems um, that was organized by SIDA and Vinnova, the Swedish Development Agency, International Development Agency, and the Swedish Innovation Agency. We put together an amazing program that was 1 month long, learning about innovation systems thinking and experiencing the innovation system in Sweden, and then being able to come back home as a change agent to start implementing some of that thinking in the work that I was doing at Cambridge. And this was really a huge turning point for me in my life, because I started looking at the big picture, moving from where I was focused with my test tubes to expanding my thinking to understand, to having a line of sight from what I was doing in the labs to how that can actually end up in a manufacturing setup and ultimately in a health system, being able to, impact people's lives. And that was really something that just blew me away. And I was able to quickly start organizing and reaching out to people who had a similar desire to see science really being able to translate into impact, and starting to implement some of the concepts of a knowledge-driven economy, like the triple helix, the global competitiveness index that the World Economic Forum puts together, comparing how does Kenya perform versus the BRICS economies, understanding why are we having such a huge gap between our GDP and the and the Human Development Index, for example. So all of these things really made me realize I can't just operate as a scientist. I need to take the next step and start to build a pipeline that ultimately makes the science actually starts to have impact in the community. So there were many struggles as I was trying to do this. What the language of innovation and commercial, market entrepreneurial investments was all foreign language within my academic setup, within the research organization, and so I really did not have a lot of institutional support, even as I was trying to wear an entrepreneurial hat. And some of this was really simply due to things like, not having a business model as a research institute on how to enter the knowledge economy. And then the other thing that I noticed is, for when you're talking of things like the triple helix, you to be able to build a health innovation system. The work and the initiative kept falling through the cracks. So on the one hand, it's a health innovation system, so does it belong under the Ministry of Health, or the research and academia falls under the Ministry of Education? And I'm talking about industrialization. There's a Ministry of Industry. So who is a champion among all of this, and how do you get entities to work coherently? Risk tolerance within public sector is generally low. And even within academia, we don't publish our failures, we publish our successes. So just the mindset, the enabling environment was really restrictive. And I think ultimately, because we still pioneered, and together with my tight group of friends who were trying to be very entrepreneurial within that setup, we still had more basic challenges.
So, sure. Sweden must have been a fantastic experience. It's a great country, one of the best medical systems in the world, one of the most equitable medical systems. That experience itself would have been, so amazing, very intellectual. How would you rank that as a change within all the gamut of things which you have done in life?
To be that was a watershed moment. That's when I think I, in a sense, found my calling in terms of how do I connect what I'm doing to solving the poverty issues, and it's important to highlight that for the health sector, when you are in a low income country, low and middle income country setting like ours, focusing on health purely from a social impact perspective does not cut it. I can assure you, poverty and health are so interlinked that poverty is both the cause of poor health and a result of poor health. And so there's this vicious cycle that if you don't understand how do we break that vicious health from within the public sector thinking, from it being just a black hole that is demanding more and more funding, it can actually be seen as an economic pillar that can actually build the tax base, actually create jobs, actually create wealth, even as you solve the social impact issues. Then it's very difficult to get government to invest in health, R&D, and ultimately to actually the sustainable development paradigm. How do we move from a vicious cycle to a virtuous cycle that is, come up with solutions in research, in academia, monetize those solutions with frugal innovation thinking, with social entrepreneurship thinking, and start creating jobs, start creating value chains, start creating solutions. To me, that is really what has become my rallying cry or my life's work since that time.
Well, I think you are doing an amazing job. I mean, just to share some statistics, Villgro Africa has made a deep impact on the lives of the underprivileged people in Africa, which you mentioned. You have impacted more than 1 million lives, invested about over 800,000, 24 startups. Now, according to Africa Business Community, 11% of Africans experience catastrophic spending healthcare every year. Now, 38% delay or forego healthcare because of high cost. Now, something which happens in a lot of, like you said, low and middle income countries. Now, when we talk about this, do share the impact you created within the healthcare sector, and how do you think technology is leveraging inclusion within the healthcare sector? Just to but I want to congratulate you for the you have had a deep impact on the lives of the underprivileged people in Africa.
We do have a very high, let me call it the poverty trap, in terms of a lot of investment that goes towards development in Africa can very quickly be undone by a catastrophic health spending, and COVID is one good example of a pandemic that has come, and our economies are very vulnerable to this kind of disruptions. Before COVID, we had the Ebola outbreak in Western Africa, and it reduced some of those countries back to negative GDP growth. And the impact of HIV on Africa's economy again was devastating. Very high mortality rates, especially for people in their productive years. So there is this poverty trap whereby when we don't invest in Africa, when we fail to invest in health systems and also in making sure that the health services are accessible to the population, then a lot of the gains that we make in other sectors can very quickly be eroded. So technology is able to help us address that challenge in several ways. Number one, the mobile platform, for example, it has been a huge catalyst in terms of different kinds of innovation, from fintech to microinsurance products to telemedicine. So looking at it from, again, access to healthcare, what we want to do is to achieve affordable healthcare, quality healthcare, and you find that all of these things, something as simple as a mobile platform, can be able to speak to that in multiple ways. Another way of being able to do it is also looking at the fourth industrial revolution. So when you're looking at aspects like medical devices and diagnostics that are interfaced, number one, again, that are built for Africa. And why do I say so? We have a broken market system. So 25% of the global disease burden falling on Africa, but then the same continent being only 3 to 4% of the global pharmaceutical market, maybe 2% of the global medical devices market, because of the low purchasing power, and so the need does not equal to demand. So how can we again leverage technology to ask why does an ultrasound machine need to fill an entire room? With all the technological advancements, can it be smaller? Can it be cheaper? Can it be able to do what needs to be done without sacrificing quality, but at a much cheaper rate? And there's so many ways that by being able to have multidisciplinary approach to technology development and innovation, that we can lower the costs of health technologies and make healthcare affordable, accessible. And so I see technology as a major technological innovation as a major game changer in terms of making healthcare accessible. and helping us to overcome that poverty trap or to spring it.
But you also, you mentioned in the report that Loin's economies in Africa, some of the highest growing economies, and one of them, of course, is Kenya. And I think Kenya is also the Sustainable Development Head of Africa. If am I correct here, Robert? Right.
Well, we're doing fairly well, but there's still lots of work to be done.
Yeah, sure. Yeah, no, I know. Because in Loins, like, Ethiopia was there and then there was some problem. So these are the fastest growing economies in the world, but they're not contributing towards elevating poverty in Africa. Because Africa's share in the poverty stricken, which is like a part of the global share, will rise from 60% in 2016 to over 80% by 2023. Now, what is bothering you? Because it's getting a lot of inequality, which is what is happening. I mean, there was also a report I wrote about India, how the inequality is rising so much in India as well. So, about the whole scenario, what do you think is what's concerning you, and how do you think we can, Kenya and the whole Africa can make the growth more equitable?
Okay, yeah, I think the first and the low-hanging fruit is, having universal healthcare. We really need to be deliberate in terms of springing that poverty trap, and being able to have government policies and government universal healthcare is really important. Not only does it provide the financial, it removes the burden for out-of-pocket expenses to access healthcare from the citizens to government, and risk pooling mechanisms and all that. So I think there's that immediate benefit that will accrue to the individual citizens and their families. The second one is we need to avoid shortcuts, and I think here I'm looking at the thinking around economic development and industrialization that I see in Kenya and in African economies vis-a-vis the Asian economies. We're not seeing a lot of high technology, high-tech industrialization in Africa. What we're really seeing is, taking shortcuts, like setting up export processing zones, EPZs, that when you look at it, they are very appealing for a short-sighted political class that wants to be able to point at jobs that they've created when they were in office and things like that. But in reality, what they are is a race to the bottom. We are competing against each other to offer tax breaks. We are competing against each other to offer cheap labor. And what the manufacturers will do is that they will, jump from one country to another as they exhaust the tax breaks and whatever else they're given to welcome them there. So we need to find ways of understanding how do we maximize local value chains? How do we have homegrown innovation and homegrown manufacturing base that can be able to, properly build, a knowledge-driven economy. And similarly, we also need to shift from the extractive economies. This idea of if we're able to mine oil or gold or diamond or the rare earths that are used for making the chips, computer chips and all that. How can we be able to move from an extractive economy to a knowledge economy? And to me, that is where it's really largely uncharted waters for most of the African economies. And because of not being able to do so, we are in almost every case being set up for extraction and then being set up as a market for the value added product, where we have the potential to do the value addition locally and to be an export focused economy. So to me, I think that those are the key things that we need to address. And the last one is to understand that there's another major advantage of another major paradigm shift, which is to move from the informal sector focus. And I think if you look at countries like Kenya, East Africa, the microfinance space has been a runaway success. But microfinance really speaks to livelihoods. It doesn't speak to um, formal businesses, building companies that can, again, within the knowledge-driven economy, what we do is we're building a tax base. We're building, export-focused companies, multinationals from the blueprint. And as they grow and as they mature, they are able to have the ability to withstand some of these disruptions or economic shocks like the COVID pandemic, which when you look at an economy that is so heavily dependent on the informal sector, livelihoods, kind of entrepreneurship, micro entrepreneurs, the ability to withstand shocks is much less. So how can we build the formal sector? How can we build a knowledge-driven economy? Is really going to be to me, when I look at it, I see it as a key difference between the Asian tigers and the African lions. That ability to create jobs that are, sustainable, that can uplift the masses and create a middle class in a big way. To me, that those are the things that I believe, from a policy standpoint, we need to be able to focus on.
That's, you talk about something very interesting. You talked about a couple of things. You want to make universal healthcare. And one of the reasons I think what you're thinking is raising tax. Do you think that's one of the things how the government would be raising taxes on corporations and individuals, specifically the wealthy ones? Do you think that's something which can be used to make universal healthcare?
Yes, but also a universal tax, because what happens is, so if you look at a country like Kenya, more than 80% of the employment is in the informal sector. So informal sector these are businesses, enterprises that in most cases are not registered.
So exactly like India. I was about to come to that second question. Good, you spoke about.
So they don't pay things like the whatever you earn, or the income tax for individual employees. They avoid that. You only can cut the tax bracket is the universal taxes, the duties, the taxes that we pay when we are buying, fuel and things like that. So by and large, they operate in a space that's free of tax. It's the government's resources. They're taking advantage of that, but they don't contribute to the kitty. So to me, I think we do need to look at even innovative ways of taxing, whether it's from the cashless, and since we have a huge movement from cash-based economy to more digital, mobile-based currencies and transactions and all that. So how can we have a more fair, a more equitable tax system, and then be able to now invest in things like UHC?
Yeah, it's very true, and I think M-Pesa has become quite a hit. That's very true. Like, how do you bring in digital currency, and that I think is going to make the whole economy more efficient. And you're very correct about the informal economy. That's what also I wrote in one of the reports which I've seen. I mean, I think in India about 80 or 90% is like in informal economy, and that's I think a very insightful take. Now I come to something which is very extraordinary happening in Africa. You recently invested in Rescue. So that's one of the companies collaborating with Ministry of Health in Kenya and Bold, and there are a lot of other places where it's collaborated. It's known as Wheels for Life. Now, Wheels of Life enables expectant mothers to reach the hospitals during curfew hours. The inventiveness here is a significant success during the pandemic, especially with all the mothers who have used this service have survived. Now, this is something incredible. I checked out the site, and I think it's a phenomenal idea which is scalable, which could also be done in India. very specifically. So do share about how this remarkable idea took root.
So this was an idea that started with um, the entrepreneurs themselves, and Rescue is a company that we incubated, and they successfully graduated from our incubation program. But as we were looking at the the pandemic, the COVID pandemic happening, and eventually, initially looking at it in China and then seeing it moving across the world until where it was here in Kenya, we asked ourselves, what can we do? How can we be part of the response to this pandemic? And we were able to reach out to our partners and quickly put together a small COVID fund that we said we should be able to allow innovators to try out various ideas, just to see, to again build resilience for our health system, because we're already seeing the collapse of the supply chains, the global supply chains, and all of that, and the ramifications of it in the health system. And it's also good to point out that for us in Africa, our health systems have been so underfunded for a long time that we are again worried about what's going to be happening here. And I think the predictions initially were pointing at a really horrible worst case scenario for Africa. So we really wanted to make sure that anything that we can do to bring solutions quickly to the table would be could be that's in our power to do. We're going to do so. And so Rescue approached us and basically said, we have this initiative where they'd already been providing. And let me first talk about Rescue and why we incubated them in the first place. They realized that when you're in a city like Nairobi, and you had a heart attack by the misfortune of having a heart attack in a restaurant, in the office, or something like that, or even at home, there's a precious few minutes within the medical attention, first aid, and all that, and get you to a hospital that would make the difference as to what the prognosis would be. And what they realize is we do not have a public number, or within the public system, the equivalent of the 911 in the US. In Kenya, back in the days, we used to call it 999. And as we were going through the structural adjustment program from the World Bank, some of these amenities that the public sector used to provide just was stopped, and there was nothing that filled that gap. And so they said, how can we solve this problem as a social enterprise? And what we loved about their thinking and their approach is we realized that it's not a problem that's unique to Kenya or to Nairobi. It's a problem that you'll find in a lot of our in the global south, whether you're in India or Latin America or Western Africa. We generally don't have a 911 to call. So how do we deal with emergencies? How do you provide ambulatory care? And they built out an Uber platform, or an Uber for ambulances, where they were able to partner with ambulance owners that were all doing their own little thing, bring them together, and then build out an AI platform. And we were able to work with them and see them leverage artificial intelligence and machine learning to reduce the emergency response time for ambulances from over 40 minutes to less than half that in a space of about a year or two. And out of that fraction, they started becoming a partner to government whenever we had things like the elections or something, if there was a terrorist attack or something like that. The government quickly realized that we can count on these guys to bring to bear the ambulatory services in a very timely and effective manner. And so when the COVID pandemic happened, the curfews came into play, and so there was this issue of how do I, if my wife is expectant, it's curfew hours, it's very difficult to move from here to the hospital. Um, what do we do in this particular case? And so as having already shown the potential and the effectiveness that they have, they were able to partner with the government and the local government in Nairobi especially to provide their services and to partner with CSR organizations to create that safety net for maternal child health. And this was such a success that it was quickly scaled up into the neighboring counties within that time when we were having our first lockdown. And again, just to speak to the effectiveness of ambulatory services that are, working within minutes, not an hour or half an hour plus. It's just a lifesaver. Very simple, very basic service, but it really takes, again, technology and a social enterprise thinking to bring technology to bear and to actually have a life-saving impact.
Oh, great. Now you shared a lot of interesting, insights, a lot of interesting facts. But I wanted to ask you now, as an add-on, before I go to the question on genomics, which I really want to ask you because you're an expert, is that you talked about World Bank. Now, World Bank and African Development Bank are doing a lot of work. So how do you think that has been enabling a sustained social change and impact in Africa? You think, how would you rank that work? How critical is that work which they bring in, especially in the healthcare sector?
Oh boy, that's a good question.
No, I
The
just
health
wanted
sector
because
is,
African Development Bank is doing a lot of interesting work. I think it was rated one of the best multi-development banks in the world. I'm not sure on that. I can find out, fact check that. I was just like keen to know because World Bank, and I keep reading that World Bank is doing this, African Development Bank, and I think they are some of the most critical enablers, specifically in the development sector. From your experience generally, and I'm sure you meet so many, what would your thoughts be on that? Just a very journalistic opinion. You think how
yeah,
they are helping, how they could help more?
I think they're doing a lot of good work. I mean, um, we cannot overstate the value that these organizations are doing. So if you look at what the World Bank has been doing, so the health sector, let me put it this way. As I pointed out earlier, Africa's health system or market within the health sector is there's a broken market system. Our need does not translate to demand. So we don't have the private sector tripping over themselves to come and serve our health needs. And so the health sector has been the domain of the development agencies, of donor funding, and philanthropy. That has really been the mainstay of the health system between them and government spending. So we have to give credit where it's due. I think there's been a lot of great support within the health system from all of these development agencies. That stated, I think it's also important to say that there's also room for improvement. And in particular, one of the things that people, and I love the framing that the United Nations came up with of sustainable development goals. How do we do this work in a sustainable way? And there's a nuanced approach to it where we need to understand how do we shift gears from philanthropy, from donor funding to resilient systems, building value chains, to building market-driven approaches that can achieve the same in a more sustainable manner. And the biggest challenge I face from when I'm looking at the health sector space as Villgro is there's very little appreciation for startups. Everybody wants to see scale yesterday. So if you're not already operating at scale, it's very difficult to find an entry point into the value chains. And within the development agencies, the philanthropic funding, the DFIs and government funding, um, there has to be, we cannot just invest with a short-term thinking. We also need to be able to start investing with a long-term thinking of saying, how do we start small? And for me, the caveat is, to be honest, we don't have an option other than to start small. We don't have the big multinationals building technologies for our market. We are an underserved market. We need to build those technologies ourselves. We need to build the farms, the companies that can build those technologies. So we need to start small, but also it's good to highlight, starting small is inescapable, but staying small is inexcusable. Our need is so great that these companies need to be built properly. They need to be scalable companies that will actually scale and deliver impact in a much more sustainable way. So that middle ground of being able to interface the long-term thinking with the short-term, very immediate thinking is the to me is the bone of contention. Easy to create a startup, like Rescue, and then have donor funding or philanthropy come in and just knock you out of business by providing the same things for free. Very short-sighted actions that can totally erode industry and kill industry and kill entrepreneurship and kill sustainability.
Okay, cool. Yeah, but yeah, it's so true that you have to be scalable. I mean, and I think, like you said, there are a lot of enablers which could help enterprises to just scale up. And so yeah, now I come to a very interesting question. We talked about so much of healthcare. So according to Health Network in Africa, about fewer than 50% have access to modern healthcare facilities. But then Africa has like about 25% of the global disease burden. Now, you are right that Africa did a good job in containing COVID-19. I mean, there was a lot of, like I've said, you should always prepare for the worst and do it so that, when you prepare for the worst, you'll always come on the top. Usually, you will take a lot of visionary steps, leveraging technology, which you talked about. So that was a very good initiative. Now, when you're talking about like with health coverage, which is about 4% in Africa, and government expenditure is less than 10% of the GDP, how can genomics? Now, genomics is a very interesting field which is catalyzing the healthcare sector. Genomics helped a lot. Initially, even China used genomics to do genomics sequencing of SARS-CoV-2, which helped the world a lot. My particular question will be divided into a few sections. One, of course, when you're talking about COVID, you could talk about genomics, the importance of genomics, and the importance of genomic sequencing, especially when there are a lot of mutations, there are a lot of threats of mutations coming in. So how important is that for a country to be, keep using that for diagnostic or vaccination purposes?
Wow, I think it's wow. Genomics is definitely going to be, and it already is, the biggest driver for the pharmacology innovation, for the pharmaceuticals sector innovation, and we are already seeing, what we talked of in terms of not too long ago, precision medicine was something that sounded wow, very futuristic. But today, it's something that's there. You can get your genome, your full genome sequenced for less than $1,000
Okay.
today. So the technology has, in terms of costs, in terms of the accessibility, it's already there. For conditions like cancer, we're already seeing a shift whereby it's not a matter of just coming up with a drug and administering the drug to anybody. The drugs are already being built with the knowledge of these are the gene in our population, and this population will do better with this drug, vis-a-vis this kind of gene set and all that. So this is likely going to be the it's becoming more and more mainstream. And again, even as you're talking about COVID, what we've been seeing is we're now talking of all of these different variants emerging from different parts of the world, India, South Africa, the UK strain, and so on and so forth. And Tanzania, I think we recently were seeing new variants that have not been seen anywhere else in the world, and with different characteristics, with different implications in terms of the epidemiology of the disease and how do you control it. So to me, the genomics as a technology is here to stay. It's really becoming a fundamental tool in the biomedical sciences and increasingly to become a mainstay also in the healthcare delivery. And as Africa, we do have a major challenge. So if you look at all of the human genome database in its entirety across the entire world, we as Africans and people of African descent, we are not represented. As recent as 2019, there was a publication that was pointing out the fact that African DNA is 2.03% of all of the entire global database of human genome that exists. So this is the genome that is, from which we are looking at in terms of designing of drugs, designing of vaccines. It's the same one that we're looking at in terms of gene therapy and other, all these advances that biotechnology is bringing to bear. And when you have, again, a population that is roughly about 11% of the global population, 25% of the global disease burden, but 2% of the entire genomic database, you start to realize not only we actually now been locked out of pharmaceutical or biotechnology innovation, and this is making a situation that is already bad, extremely bad. And what do I mean? If you look at something like the HIV pandemic, there was a 10-year lag from when ARVs became widely available in the north to when those same drugs started becoming available in Africa, notwithstanding that Africa was already bearing the brunt of the disease. So if without genomics, we have a 10-year lag plus, 10-year plus lag phase from when drugs are introduced in the developed countries to when they become readily available in our markets. Then now you throw in the genomics as a further bottleneck in terms of our access to health technologies. We are in a really very precarious situation. And so the solution, obviously, is to build capacity within Africa for genomics and for pharmacogenomics and all the promising research and innovation tangents that come out of genomics. And being able to do so will then be able to really reestablish our drugs, vaccines, innovation security. So I'm not even talking of just the availability of drug security. I'm not talking of the drug vaccines innovation security, if I was to call it that. Just by making it possible to actually have pharmaceutical products that are going to work for our populations also.
You spoke about and there's a lot of reports. Even Bill Gates was like you're correct. A lot of people had predicted because of the COVID Africa, so many things would happen which actually didn't happen. And in a lot of ways, I would say Africa was ahead of the curve in implementing certain practices. Now, you talked about investing in like core companies which could help, and that was a very good example which we discussed. And you spoke about rescue, startup. Now, apart from that, what do you think could be a couple of things which maybe things went right? Because of that, maybe the effect of COVID-19 was not as devastating as it was predicted. It could be like maybe lockdowns at the proper period of time. It could be social distancing norms. It could be testing. What do you think was some of the right things which not only Kenya did or other parts of Africa? There are certain places which are doing really good. Read about it a bit. Rwanda, I think, was implementing certain practices which really helped. So just to have an idea about you.
I think number one, we in Africa, infectious diseases are still a big challenge. And so there has been a lot of investment in terms of the expertise from being able to control, being able to even do elimination programs and things like that for some of these infectious diseases. And I think we had a head start, so to speak, in terms of being able to read what's happening and start acting automatically. And even in doing so, we were not wasting a lot of time on trainings and things like that. It was just really activating existing capabilities and bringing them to place. So I think Africa was a little bit blessed in that sense. Then the second side of it, in terms of the COVID response that we saw in Africa, is the population's willingness to obey government and to take, to agree to go into lockdowns, where things like masks. I mean, it's not like it was, just. I think Asia, I see a lot more compliance in places like China, Taiwan, Korea. But I think for us, nevertheless, we were still understanding and trusting government's leadership, so that when we are told, don't travel, don't do 1, 2, 3, we did not politicize it. We didn't understood that these are extraordinary times, and these are extraordinary measures, and they're temporary. And the government was able to, monitor the situation and whenever possible give us the relief of lifting some of the very stringent measures that they had taken. So that was also really helpful, that the government was both proactive but also and public outcry when things were extremely restrictive and we were wondering how do we survive. And then ultimately, I think we've just been fortunate that our very relatively weak health systems have not been, challenged head on by a huge COVID outbreak. Yes, the numbers have been there, but they really have not been that big, with the exception of maybe South Africa and Egypt. So when I look at it, I think there'll be a lot of research that has to be done later to pinpoint what exactly were the factors that saved us. But I think it's good to give credit where credit is due. The governments were quick to respond. The populations were trusting and followed the government's leadership. And overall, we did try to come together to make it harder for this disease to come and establish a presence. And yeah, we're
True.
just fortunate again.
Yeah, true. I mean, you spoke like, I really love what you said is these are extraordinary time and these are extraordinary steps and everybody knows this is temporary. So I think that's precisely what is great about this mindset, what people took. And you spoke right. I mean, China did great, Korea did great. I mean, Japan did great. But I mean, the stories of Vietnam and New Zealand, how they have come up, are extraordinary. And this, I think, during this pandemic, has also reflected a lot good of how like Africa. I recently did research in Kenya and Rwanda, and both Kenya and Rwanda, the cases are going down, at least the daily cases. So I'm sure at some point in time there's be flattening of the curve. I haven't seen that, so I really don't know. Maybe a flattened. I really don't know what's happening on that. But at least the daily cases have been going down. So, yeah, true. I mean, some of the work is very due credit. I think is in a lot of countries in Africa, they sort of realized what the risk is, which you said, and they took preemptive measures. And they, you all had, for example, Ebola. You talked about. Now, Ebola has a 50% of. I read. It was one of the deadliest viruses. 50% of, in the sense, it would kill 50% of the people, right? So mortality was very high in Ebola, and to sort of come out of that would be a huge achievement.
And those were the lessons, and I think being able to look at it and ask, if we've overcome this, then what is it that, how can we be able to apply the same?
Africa is a very vibrant continent. So there are a lot of things which are happening now, and there's a lot of awareness spreading. So when you talk about gender lens investing, that's a major issue today. So as a leading impact investor, what sort of enablers are you employing to accelerate and nurture women-led entrepreneurs?
Yes, so this is one area that I think we have a lot of work to do, and even as Villgro, one of the things we've been asking ourselves is, how can we have more women representation within our leadership? How can we have more women representation at board level, at top management, our pipeline, in our portfolio companies? And it's not easy. We are working at the interface of science and industry and finance, and everywhere you look, there's a gender challenge. There's a gender imbalance in STEM, in science, technology, engineering, and mathematics. There's a gender imbalance in venture capital or investment banking. So there's a gender imbalance in entrepreneurship. We know they make great entrepreneurs. We see higher than average returns in women-led startups. But you also have to appreciate that the work-life balance for women is a much bigger issue, because they are also the homemakers, they are the caregivers, there's all these things in terms of within the society's roles that women do above and beyond what men do. And so there's that very slim pipeline or talent pool for the space that we're operating in. But we are becoming more proactive, and one of the things that I believe makes it very simple to start making progress is to measure. What gets measured gets done. So we've been asking the question of ourselves every time we put out a call: how many women applied? What were the barriers? How can we be able to understand from women those barriers and start to address them? And these learnings, incremental learnings, as we apply them, we're hoping to begin to see more and more women entrepreneurs within our portfolio, and more women within our leadership teams and governance and all that. And ultimately, I think it's to humanity's loss when we don't see the capacity, 50% of our human race coming to bear on the big challenges that we're facing, the big developmental challenges. my thinking is it's to our loss, it's to our shame, and we're not. There's so much more that needs to be done to really capture that part of that the wealth of human talent, innovation, entrepreneurial, and otherwise that is just untapped.
Oh, very good. So a lot of things are happening. We talked about healthcare, which is one of equitable healthcare. It's so important, which even I feel like in India or so many other countries, that's one of the most important enablers. Now, quality education is another. There's a lot of financial inclusion going on in Africa. You talked about STEM, STEM education also. So quality education becomes a very important enabler here. Then there's WASH segment, another one, and I feel like one of the most important parts of Africa, I think one of the greatest, is that natural beauty in Africa, and that should be preserved. All of them, which particular one sector you will say is like, okay, I feel like these are more important. You want to sort of say, okay, healthcare, I do understand, but which other would you give one of the most, if you had, let's say, only time for a couple of sectors, which two sectors would you say are the most important right now for Africa?
I think without a doubt, agriculture. We are still a food insecure continent. We are dependent on imports to be able to feed our population. And yet, I think we still have the most, from what I read, I think Africa has the largest available arable land. So we are punching below our weight.
Yeah.
And we're having one of the fastest growing populations. So how can we again build a knowledge-driven economy? And here the mismatch is very simple. The developed countries have been able to have a green revolution by virtue of going focusing on large scale plantations. In Africa, it's all about the small holder farms. And there's an innovation gap that needs to be filled, whereby we start asking, how do we bring this mechanization of agriculture, not for large scale plantations, not for those huge what do you call them? I see these amazing tractors that have a processing plant all together as they go through the field. If my land is half an acre, 2 acres, 5 acres, that kind of machinery, mechanization will not help us. How do we also then address the market? Because to me, I think if you want people to invest in agriculture, we need to understand what are the market failures we have within our economies. Is it lack of data? Is it lack of access to markets for farmers? Is it lack of quality? So there's a lot of work that can be done in agriculture. How can we avoid post-harvest losses? How we process foods? So there's so much work that I think needs to be done in agriculture. That if you're hungry, nobody's gonna focus on anything else.
Yeah. Yeah, that's
so,
very.
So we need to do that. And the second one is manufacturing in a big way, and start to say, how do we get local value addition happening? How do we get trade happening within the continent, intra-Africa, so that it's clear, if places like East Africa are doing very well in livestock, places like West Africa are doing the cocoa, and, we can have regional trade. But I think so far when I look at Africa, our infrastructure, our trade systems are built for Africa, Kenya to Europe to Asia to, so that has been a huge gap in terms of the way we've gone about nation building and addressing our developmental challenges.
So, thanks. We had a very riveting, we had a very insightful, very informative conversation. and there are a lot of things which made it so clear. There are a lot of things which now, if when you take a wheel, you put that lot of dots which are missing, so that you can connect a lot of the overall picture, not development sector. So before I go to the last aha question, wherein you can share one of the happy moments, I do know you had your own share of tragedy during the COVID-19. So we'd like to share something about it. And what do you think? Anything about COVID which you think is in Kenya very specifically, or anything which is going okay and which could get better, or anything to say? And then we'll go to the last question.
Yeah. So I thank you, and thanks, Nishant. Yes, we at a personal level just recently lost my father, who, talk of an untimely death, because it was a really big blow to us. This is a man who honestly was never sick. He enjoyed a very good, healthy life, and we were expecting he's going to be around for a long time. But so his demise was it's a big blow to me personally, to my family, and it just goes to show that this COVID pandemic is very real. We are fortunate that we are still being able to access healthcare and so many things, but that's not normal. That's not something that you take for granted. I know people who, for example, our health system, we depend a lot on medical tourism to India for any advanced care, whether you're talking of cancer or advanced surgeries and all that. And, even just looking at what's happening in India and realizing that has forced a lot of people that were already getting treatment to have to come back, not that they got better, but just because the health system there had fast response to a pandemic. And, as we are speaking, it's, now initially we were talking of the COVID, now we're getting indirect COVID deaths, people who are getting the cancer treatments, the heart surgeries and all that happening in India, and have had to come back, and it's disrupted their care. Unfortunately, we are beginning to lose them. And so we are interconnected in many ways. And to me, I think we just need to be able to understand that investing in healthcare, investing in the infrastructure, investing in resilience of our health systems is important. We do need to address some of the most basic issues and crisis. It's been one of my biggest worries for Africa, knowing that even before COVID, we really didn't have oxygen readily available. For a mother to see their child receiving oxygen, they would almost give up, because it's such a rare commodity that it's only the very, very sick cases that would get it. So it doesn't come in as a treatment, it comes in as palliative care almost. So, already within our society, we know the prognosis, the minute you see oxygen being administered, that's a very poor prognosis. Because that means if you are so serious, you've finally qualified to get a very rare commodity. So how do we view it is a lot more robust, that's a lot more resilient? To me, I think, going back to my argument of frugal innovation, why does it cost so much to produce oxygen? If we are the ones who have the need for frugal innovation. The West doesn't. They can afford to pay for unnecessarily expensive health technologies, simply because for them, they have the resources. For us, we need to do more with less. And so the frugal engineering principles really need to come to bear to solve our problems for us, create health technologies that are affordable. We don't need all the bells and whistles. We just need something that gets the job done, and make healthcare ultimately more affordable. So to me, that is, I'm very passionate about making healthcare accessible, understanding what are the key drivers of costs for healthcare. And then the second part of it is preventive is better than curative. And this is tough. Nobody values health until they lose it. So how do you incentivize people to invest in in preventive healthcare?
I love some of the very important things. Preventive is better than curative. It's so good. I mean, like in a few words, I think you just put words in my mouth. Those are the words maybe that made a lot of countries in Africa be ahead of the curve, which I talked about. They implemented, and which. So now I come to the last question. You always have aha moments, right? Anything which sort of gives a smile to your face. So you could share with the audience anything which you think which it could be something from your job, it could be something which you see in recent life, which brings a smile. I know you're very passionate about Africa doing good, and Kenya is one of the most important countries, not only in Africa, in the world. I think Kenya is now on the threshold of maybe taking or guiding a lot of economies in Africa, laying down the parameters or benchmarks. And it's like you also mentioned a very critical thing, which I wanted to elaborate. You said Africa would be will have the highest population of young population in the world, maybe another 10 years, right? The highest in the world. And yeah, unemployment could be one big scenario, which indirectly you also hinted is something which Africa has to think about, how to get employment, how to. But saying that, and you could talk about any moment.
I think for me, it goes back to my time in Sweden, and that's the light bulb that went on, that the science that I'm doing is actually an economic activity, and how do we interface science with private sector, and to me, it's very fulfilling. If you'd have asked me, about some time back, I'd tell you, if I was to go back to university, I'd probably not want to do economics. I love, I love understanding how the world works and being able to build economic interventions. But I'm realizing being a scientist is actually the front line. We're the frontline soldiers in terms of economic development. And how do I get more and more scientists? How do I get more and more engineers to think that way and to own that process? Because the minute we're able to do so, the minute we're able to not do science just for the publications and we have a very weird academia culture that it's all about publish or perish is what we say. Your promotion, your academic, your career progress is all measured purely on publications. I think we are not wealthy enough as low middle income countries thinking outside the box and being multidisciplinary in our approach to the sciences we do. I'd rather we did less publications and had more impact from science.
True. You spoke about Sweden. I know Sweden is one of the most fantastic countries in the world. I mean, it's it's very innovative. One of the most innovative countries in the world. So yeah, true. Thank you. I wanted to thank you, Robert. You have done, thank you for sharing such a in-depth. You took a lot of time. You shared your thoughts. You shared your facts. I really want to thank you for, being there on the platform, the middle road, and speaking to me. I appreciate that a lot.
Thank you, Nishant, and thanks for having me. And great questions. And I'm looking forward to being an avid listener to all of your podcasts.
Thanks a lot. I really appreciate that.